Hello, everybody, from Rothrock Chiropractic and Rehabilitation here in State College, Pennsylvania. My name is Dr. Emery Pitcel, and if you are an established patient of ours struggling with a mid-back issue, you likely have been prescribed a mid-back extension type exercise. So this would be in the McKenzie Method cervical and thoracic spine packet. And if you aren't an established patient of ours and just happened upon this video, leave a like, comment, and subscribe if you found this helpful. But the main reason for putting these videos together is to benefit our established patients, to serve as a review and help them with their home compliance with these exercises. So the second exercise on the back page is called McKenzie Seated Extension over a Chairback. That's what we're going to demonstrate right now. So you're going to find a chair that's got a, halfway decent kind of chair back level. Now for this one, it's going all the way up to the bottom of my shoulder blades. That's perfectly fine for what we need to do. If we had somebody that needed to do a little bit more extension into the upper back, like between the shoulder blades, we would actually kind of encourage that patient to just kind of like change their position, almost like they're going into an inclined chest press at the gym. Not super slouched at the back, but keeping the back straight and working on the exercise this way. And if somebody needs a little more target in the lower back, either find a chair with a lower chair back or get something like a cushion or a pillow or a couple of books to stand on, something that keeps you propped up a little bit to make the line of contact lower down on the mid back. Now, what happens is, much like the other exercise, we need to get the tissue slack out of the mid back. You can get some stretch if you arch back like this. You get a lot better stretch if you take the hands and put them on top of the head, or at the very least have the elbows pulled back like this. But hands on top of the head, then we start to arch our way back over that way to create extension in the mid back. You would hold for about 2 seconds and come back forward, pull back, 1, 2, come back forward, getting that extension through the thoracic spine and the muscles. It's important to stay within pain tolerance. So if we're coming back to here and that hurts to about a 4, that's where we stop. If we could go back another inch or 2, but it hurts like a 5 or 6, no good, not effective for anybody. Don't be pushing beyond that pain line and that pain limit right there. Ultimately, we're going to say to patients that if they're going to do this exercise, that we'd like them to try to get 5 to 6 sets throughout the day, like doing the exercise every 2 to 3 hours, sets of 10 to 15 reps while performing the exercise. So what is this effective for? If we diagnosed a patient with a thoracic disc issue, although that's only 2% of all spinal disc issues, they do still occur and they do still happen. This is a great exercise for those types of candidates. We also find that rib out of place, helping to kind of systematically walk that rib from back to forward. This is a good way to work into that. And if we're dealing with some sort of heavy muscle strain on like a rhomboid or a lat muscle, a lot of times this is a good beneficial exercise to start to rehab that muscle. Thank you so much for watching. We hope that this was helpful for everybody. And if it was, leave a comment or a like and subscribe if you found it especially beneficial. And otherwise, to all our established patients out there, we wish you the best. To all of those who just happened upon the video, likewise, we wish you the best. Take care until next time, everybody.